be able to tell us a little bit more about your experience with SM6, and that you might be able to tell us a little bit more about your time with the medical academy.
Okay, well, my name is Jessica, obviously, and I'm 17. I'm studying health and social care, sociology, and applied science to become an adult nurse. I'm planning to go to university and further my studies and research because I need to, because obviously I don't know what I want to specialize in yet, so I'm trying to find out what I want to do.
That's really good. Thanks, Jess. So you said you wanted to like specialize in something. Like, what really inspired you to be able to become an adult nurse? And like, what are the different types of adult nursing that you've learned about with the medical academy?
Because my mom had an accident a few years ago, and I was assigned I had to take care of her and give her these specific injections that the doctor told us to give her at specific times. It was really stressful because obviously having to inject someone without having any experience. I gained a lot from that because obviously I know what kind of pressure, well, I don't fully know, but I have an insight of what the nurses have to go through and how they care for their patients and everything. We've had different people come and talk to us from the medical academy. We've had ODPs, we've had paramedics, we've had midwives, we've had child nurses, and being through all this, it's really inspiring to see how different people go into different job sectors and the different experiences that you go through in these, and especially in these times, the things that they have to go through. Obviously it affects your mental health, but you're that person that has to be there for the patient. So yeah, it's really inspiring.
That's amazing. I'm so glad that you had those really positive experiences. So when you joined the medical academy, how do you think it's really like helped you?
It really helped me because obviously, like I said already, we talked to a lot of different healthcare professionals, and we got to understand more about their jobs and what they did and how they prepared for what they were going into. You obviously need to understand that becoming a healthcare professional is a very tough job, and you need to be ready to be committed to what you're doing because it's not something you can just give up on once you start it. And you need to know that you have to be there for the patients and yourself as well. So you need to have a strong mental health for yourself and the patient, obviously. Through the medical academy, we've got so much help. We had a lot of talks with higher ups as well, and to prepare for our UCAS applications and everything, we were assigned mentors that we got to email and ask questions on a more personal levels to learn more about their own experiences. And the best thing was that each professional was given to you based on what you wanted to do. So yeah.
That's amazing. Thanks, Jess. It sounds like your mentor was a really good person for you.
Yes, she was.
So obviously we are in the midst of a bit of a pandemic. We are working from home at this point in time, and that's taken a lot of like adjustment. Can you tell us a little bit about your own experiences with that and how you've overcome some of those obstacles?
Yeah, I prefer learning in the environment I'm meant to be learning in, so like with the teacher in front of me and everything, because it's much more easier and I'm a visual learner. The whole online thing was a bit of a mess for me at the beginning because I had to get used to it, and it was a bit tough to like be concentrated when you're at home. There's so many things that could distract you, but then at the end of the day, like this is the last push that you have to do before moving into university or apprenticeships or whatever you want to do in the future. So yes, it is hard, but at the end of the day, you need to know that it's hard to catch up on things, especially in this situation, because the teachers have to be there for every single student. And yeah, everyone is their top priority, yes, but it's not always easy to give the same amount of help to everyone. So yeah, I hope that everyone just tries their hardest regardless of the situation and keeps pushing for the best.
Thanks, Jess. I think that's a really honest answer from you. And I think that that's a really honest outlook on like kind of what everybody's experiencing at this point in time. So thank you so much for joining us today and kind of sharing in all of those experiences. Good luck in your future, Jess.